Hi everyone, this is Dr. Praveen here. Today we are going to discuss about the GAVE syndrome, that is gastric antral vascular ectasia. Coming to the introduction, gastric antral vascular ectasia, so as name only suggests, is seen in the antral part of the stomach, particularly in the form of vascular dilatation. Based on its different pattern, it's categorized as the watermelon stomach, honeycomb stomach, and a nodular pattern. These are the three variants what we can see in the GAVE syndrome. One is which looks like watermelon, second one is as that of the honeycomb, and sometimes it looks like a nodular pattern. Even though it's a very rare condition, but it is a significant cause of acute or chronic gastrointestinal bleeding, that is in the upper GI bleeding, a commonest cause. Is associated with the heterogeneous medical conditions including hepatic, renal, cardiac diseases, because whenever there is a disturbance in the hepatic, renal and cardiac diseases, there will be a sympathetic hyperactivity will takes place that result in the motility disorder and result into a GAVE syndrome. The pathogenesis is still unknown, but we can list some of the conditions or hypotheses. GAVE primarily present in the antrum. Of course, is a name only suggests gastric antral vascular ectasia, but it can also be found in the proximal stomach, cardia, duodenum, jejunum, and even in the rectum. That is, vascular ectasia is seen sometimes in the cardia, duodenum, jejunum, and the rectum also. The probable cause for the GAVE syndrome is upchlorohydria, that is decreased HCl level, hypergastrinemia, that is increased gastrin secretion, or low pepsinogen, and liver failure. There are some risk factors are also there like autoimmune conditions, chronic kidney diseases conditions, cardiac diseases, diabetes mellitus, atrophic gastritis, cirrhosis, high blood pressure. So these are the risk factors. See, as I told, the pathogenesis is still obscure, but these are the probable causes. Most of the conditions, the primary cause is motility disorder. Maybe because of vagal denervation, like in case of the diabetes, or else this is sympathetic hyperactivity, like in autoimmune conditions, cardiac conditions, renal failure, hepatic failure. So, and most of the time it is associated with the portal hypertension, and sometimes the person who is diagnosing it may find it difficult to differentiate between the purely portal hypertension or portal hypertension along with the vascular ectasia. Watermelon kind of pattern, that is a radial divergification of the ectasia from the pylorus, and this is a honeycomb kind and this is the nodular kind. It is a characteristic reactive epithelial hyperplasia will takes place and leading into vascular ectasia. Coming to the presentation, clinical presentations like chronic anemia, iron deficiency anemia, upper GI bleeding, acute or chronic fatigue. So these kind of presentations will be seen. And coming to the treatment part of that, the treatment part is basically divided into pharmacological part, endoluminal part, and the surgical approach. Pharmacologically, we can go with the corticosteroids or else estrogen progesterone combinations, tenaxamic acid, so with a significant risk of ischemic events or the pulmonary emboli, and thalidomide, alpha interferon, calcitonin, and cyproheptadine. So these are the drugs we can combine with some other drugs and use it in treatment or else in the management of GAVE syndrome. Coming into the endoluminal, APC is a commonly used treatment based on the severity. There is argon plasma coagulation with a depth of 0.5 to 3 mm. Or else we can go for electrocautery and if needed band ligation also. And third option is that is a surgery which is very rarely used, and whenever there is a requirement of surgery, then the resection is the choice. So this is about the GAVE syndrome. If you have any queries, you can put in the comment box. If you like this video, then kindly subscribe and like the video. Thank you.